Dr. Zubery, you're an experienced clinician and developer of several products. In your lecture, you talked about the underestimated potential of collagen for GBR. How exactly can it improve the treatment result?
Collagen is actually the building blocks of every tissue in our body. So when we are trying to regenerate tissue or rebuild missing tissues, we are actually trying to mimic the natural process. And the natural process always starts with collagen. So collagen is the building blocks of the tissue. And we believe that when you can master the production of the collagen and produce collagen that is the same as the natural collagen in our body, you are actually able to completely restore the tissue or regenerate the tissue.
The collagen is modified by the Glymatrix technology. How precisely does this technology work and how is it applied?
The Glymatrix is a technology that was developed in the late 1980s, so it's actually a well-established technology. There's a lot of literature, publications, scientific publication to support this technology. And the technology is actually the ability to cross-link collagen, a high-level purified collagen, to cross-link it as it is done in the body, and mimic the natural collagen. For example, we believe that the level of cross-linking and the purity of the collagen creates a matrix that the tissues around it recognize as its own. And not only its own, but like a bone collagen. That's why the cells that get in contact with this collagen become osteoblasts and start to lay down bone.
Modified collagen has a significant effect on the heart tissue response. What do scientific and clinical data reveal about this fact?
We now have clinical data, we have histologic data, but we also have lots of science and scientific publication to support the ability of this collagen to restore lost bone and build new bone and maintain the bone for a long time. And this is the things that are missing today, because today we trying to repair lost bone with particulate grafts that are taken from humans or animals. And these grafts will stay in the site forever. And we know that it has some effect on the tissue. The quality of the tissue is not as the natural bone. And we have today an epidemic of peri-implantitis that probably partially these remnants of these grafts are responsible for this epidemic.
You also talked about the Außerdem products like scaffold, membrane, or sponge. Can you recommend these products for other indication besides GBR?
Yes, we are working now on a soft tissue device. That means material that will form soft tissue only without any bone in it. And this is a major issue today, especially in aesthetic dentistry. You need high quality soft tissue around your implants and around the restorations. And of course it's applicable to any field of medicine. And we are working on it, started to work on it, but we still focus on dentistry because we believe that the dental arena is not getting enough attention from companies who develop these technologies, and that's why the quality of some of the products is not sufficient.
What are the main advantages for the clinician when using Außerdem products?
There are many advantages to the clinicians and the patients. And I put the patients, clinicians, but I put the patients first. First of all, it's minimally invasive. You can do with a single product, with a minimally invasive procedure, you can restore the missing bone and go in and do your implants easily, predictively, and the patients are happy. Less morbidity, you are not harvesting tissues from the patients, and this makes the clinician's life and the patient's life much, much easier. And the procedure is successful, more predictable, and we hope that it's going to be long-term as well.